Welcome to the Informed Pregnancy and Parenting Podcast. I'm your host, Dr. Elliot Berlin, prenatal chiropractor, childbirth educator, and labor doula. I'm joined by today's co-host, Angelica Ortiz. Angelica is an undergraduate degree in neuroscience from University of California, Riverside, and she's currently a student at Southern California University of Health Sciences, expected to graduate in April 2018 as a Doctor of Chiropractic. Welcome to the podcast.
Thanks. I'm excited to be here.
What made you want to become a chiropractor?
After I graduated, I had a few internships because I was clueless about what I could do with a neuroscience degree.
Well, then let's back up. What made you go for a neuroscience degree?
I love the nervous system and the brain. Yeah, it fascinates me. And it was way more fun than bioengineering, which is what I started off with initially.
So science from the beginning. I mean, I feel like most people going into undergraduate don't know.
Undeclared.
Undeclared, okay. But like very science. You've always liked science.
Yeah, I have. It actually started 4th grade when I went to science camp. But
Oh, science camp.
Yeah.
Whoa.
Yeah.
Okay. Usually sports camp, dance camp, band camp.
Oh, I went to every camp. My mom tried to get me out of the house as much as she could.
Oh, really?
Yeah. It would be science camp, then dance camp, then.
She has succeeded. And then neuroscience, and how did that turn into chiropractic? You love the nervous
basically with
system,
neuroscience, it's all you can do is research or become a professor, and neither of those sounded interesting to me. So I just had a ton of internships after graduating, and the chiropractor that I interned for was the happiest. His patients were extremely happy, and he gave all his patients almost immediate relief. And I just always have agreed with the lifestyle that chiropractic promotes, just like a holistic approach, letting the body heal itself.
Had you been to chiropractors before that yourself?
Not before my internship, no.
That was the beginning of it.
Yeah.
And you one crack and you were addicted.
Exactly.
I hear you. A lot of people say that. And now you're interning with me. And so you've come down in the world, which is okay.
I wouldn't say that.
But you have a curiosity about prenatal care and postnatal care in babies.
Yeah, definitely. It's fascinating, and the way that you help the women is really great.
I do what I can. I've worked with a lot of interns. You're impressive. I'm excited for you to graduate and carry the torch so I can retire and watch Netflix. Today, our guest is Hla Typing. She's a mother of 3 young children under the age of 4. And a few months back, your husband, Adam, was diagnosed with primary myelofibrosis.
Correct.
Did I say that right?
Yeah.
Okay. It's a cancerous disorder in which normal bone marrow tissue is gradually replaced with a fibrous scar-like material. Over time, this leads to progressive bone marrow failure, and it can't be cured unless he has a bone marrow transplant. And my hope is that by the time people hear this podcast, by the time you're listening to this audience, Adam has found his match and has had a complete recovery.
Thank you.
So normally our podcasts are light and fun and informative, and I really wanted to have you on the podcast because you're light and fun and informative, generally speaking. But, I've known you through all your pregnancies, and just you're a special person. I got to meet Adam long before this happened. You guys are very, very special people, and I'm working with you now, going through this process, and really learned a lot of information about bone marrow that I didn't know myself, and I wanted to share it with our audience. A lot of times during pregnancy, people are thinking about stem cells, and they're presented with the opportunity to save their cord blood, bank the cord blood or cord tissue. And it's hard. We don't really know what that means and what you can do with it and can't do with it. And so the more specific relevance to our audience is stem cells through cord blood. But bone marrow is kind of fascinating too. And I think that when we get on the topic of thinking about these diseases and how we can be helpful, there's a lot to explore here. So I'd love to go back a little bit and find out, how did you find out Adam had this disease?
For a couple of months, Adam had been losing quite a bit of weight. He was having decreased appetite. He was increasingly lethargic. And it was sort of something like I was this voice in the back of his head being you got to get to a doctor. You got to see a specialist. And so what started out with his primary care physician saying something to the effect of, well, I don't really see anything wrong. Your numbers are coming back normal. Perhaps, you're just stressed out at work. And there was a lot of that. You must just be stressed. You must just be stressed. But Adam, by nature, is not someone who gets stressed out easily. He's very positive. He's quite active. And in those months, he was less and less active and less and less energetic and whatnot. And so we have a very dear friend who also happens to be Adam's cardiologist. He was born with a bicuspid valve, which is really no big deal right now, but just has to be monitored. He then said to Adam that he wants him to be seen by an ID specialist, an infectious disease specialist, a hematologist to have a complete workup. Gosh, who else didn't we see?
Was that after seeing him for a cardiology visit? Or
Yes,
was that,
he'd been seeing him for quite some time, and then also just, again, through the friendship and getting to know Adam and seeing this sort of change in him.
Right, you can see it as a friend in a different way than
Very
you can
much
see
so.
it as a doctor.
Very much so. And so for that reason, we visited everyone under the sun. And everyone was coming back with question marks versus answers, and that was really frustrating. Until basically one day, the doctor said, the hematologist said that he had some elevated numbers, and that they warranted a visit back in 6 months rather than in a year.
Oh, wow.
And so, that was disconcerting. But we really put it in the back of our minds because, again, cancer was just not on our radar. And when we
Nobody mentioned it?
No,
Wow.
not at all. And if anything, the hematologist who even read the results sort of poo-pooed them and said, yes, slightly elevated, but really nothing to worry about.
Okay.
And he even had a bone marrow biopsy completed, and the results came back, according to the doctor who, gave forth the information, as unremarkable. Give us 6 months down the line, and the results were read very differently by a different hemonc, hematologist.
The original results?
Yes.
Not a new test?
Yes. Who said that Adam had very high cellularity, meaning that although the numbers weren't grossly out of the range of within typical limits, the cellularity was high enough that it warranted further evaluation. And so that cellularity, that presence of, this marked density that they were seeing was really this massive overproduction of cells that the body that the marrow was producing because of his myelofibrosis. So it was just, everything was just packed in and jammed in, and he had another bone marrow biopsy, which then confirmed a myeloproliferative blood disorder.
This is 6 months later.
Yes. Which still didn't scream out cancer.
But his health is, I imagine, continuing to
Yeah, he
decline.
at that point was, again, increasingly lethargic, had probably lost close to between 15 to 18 pounds at the time.
Which is for him a significant
Yes.
percentage.
Yeah. And so he was also starting to experience increased back pain. He was starting to get achy knees. And this is a guy who snowboards, who plays basketball, who is painfully athletic, just really takes to any sort of sport really quickly. And so when he said that to us, Adam was really of the mind, let's wait till we get more brains on this before we share this with our families and things like that. And that was, again, a hard process. But that physician, that hemonc, then sent us over to another who specialized in rare, less typically occurring myeloproliferative blood disorders and rarer cancers, blood cancers. And we walked in, and within about 15 minutes of being there, he said, "You've got myelofibrosis." And we were so taken aback because, in that quick Wikipedia moment, we found that myelofibrosis is something, what we understood to be at the time a slow-moving cancer that typically affects, geriatric patients at
Older
large.
people, yeah.
And so we sort of scratched our heads about that. Said, are you sure? And he said, the bone marrow biopsy can, confirm what I believe to be what you have, but it's pretty obvious to me.
What was he basing it on?
So his symptoms, the achiness, the night sweats. Oh, that was another thing. something I want to bring up, if anybody is experiencing night sweats, it is not typical.
Oh, yeah.
And I'm not talking about, you're perspiring, or those mamas who, post having kids are, soaking their sheets. That I've been through that. That's okay. But if you are a seemingly typical 30-something-year-old who is sweating through 1 to 2 shirts a night, that is something that you want to look into. That is not okay.
Without explanation.
Without explanation, very much so. And I'm not talking about hot summer nights.
How long was that going on for?
Probably, I want to say sporadic, over 5 months.
Oh, and even then the doctors didn't...
No, it was something that was written down. They tested Adam from everything to, all kinds of like flesh-eating bacteria to irritable bowel to all sorts of things, to allergies, all kinds of things. Is it a gluten issue? All kinds of stuff. And that wasn't the case. And the bone marrow biopsy results, and also how he was presenting clinically with his bone pain and his achiness and what he believed to be his back pain, the doctor was very comfortable with the diagnosis. And so he explained to us that this was a slow-moving cancer, a slow-moving blood cancer, and that Adam could be put on a series of medication that could help minimize his symptoms but not stop the cancer in its tracks. And definitively, the only cure for said cancer would be a bone marrow transplant. But that really wouldn't be something, according to him at the time, wouldn't be something that we'd have issue with for years down the line, and really not something that we need to have in the forefront of our minds. So we put the notion of transplant in our back pocket because that was a very disconcerting word to hear.
Of course.
And we moved forward with, what we believed to be this chronic, slow-moving cancer. About 2 weeks later, Adam believed he threw out his back and had excruciating back pain to the point where he could barely move from bed to bathroom, from bed to couch. It was really difficult. And so after a few days, he'd gone into his hemonc and explained to him his symptoms because he wanted to actually ask his permission to get a cortisone shot, if that was okay, even, given his diagnosis and whatnot, to alleviate any of his pain, or even an epidural because the pain was excruciating. And you could sort of see that the color ran from the hemonc's face, and this look of concern just washed over the entire room. And I even remember that moment. My father-in-law was in the room, my husband was in the room, and I was in the room as well. And I immediately got up, and I feel my voice quivering even as I'm saying it. But I kind of grasped the handles of my chair as I stood because I knew what he was about to say was not good news. And so what he said was that he believed that the cancer had sort of transformed and progressed into a slow-moving chronic cancer, to something far more aggressive, and that perhaps it had actually transformed into leukemia. And so Adam had another bone marrow biopsy right there and then, and he had a very high count and was brought in 2 days later for inpatient chemotherapy. And so we just went from,
Wow.
This happy family of 5 with a 5.5-month-old at the time, a 2-year-old and a 3-year-old, to 2 very scared people trying to balance cancer and babies and fear. And it was very scary and very, very isolating. And that really was the start of our journey.
Wow. I don't want to cut you off at all, but hemonc is...
A hematologist oncologist.
Right.
Yes.
So this is...
A blood cancer specialist.
A blood cancer specialist. How does someone get this kind of cancer? Is it a luck of the draw? Is it genetic?
So that's probably a sort of culmination of things. In Adam's case, thalassemia is something that runs in his family, and that's a blood disorder in and of itself. He had a distant relative who had experienced leukemia. But Adam's cancer has much in part to do with, and this is through the sort of like the genetics that were then picked at and picked apart thereafter. but Adam has what's called an ATM gene, and he's actually the only known and documented case in the world who has this one gene. Basically, I'm going to say this. He has something in his body that doesn't allow his body to stop production or overproduction of cells. And so his body is in perpetual, factory mode and just cranking out cells.
It's a genetic mutation.
Very much so. And one that's very rare and very specific to Adam's case.
Okay.
Yeah. I remember a physician friend saying something to me to the effect of, when asked, what does Adam have? He says Adam has Adam's disease,
wow.
because it's so rare in nature and it's so different in its quality.
It's interesting also that you said, in retrospect, you must look at some of these doctors and want to shake them and be like, why didn't you find this?
Yeah.
But as a practitioner, I can tell you sometimes, and you might have seen this, Angelica, in clinic, and you'll certainly see it in practice. Sometimes someone walks into the office and their body has not read the textbook at all.
Right.
So my first gallbladder diagnosis, right? Gallstones was, the mnemonic for gallbladder. It's not really politically correct, but it's the 4 Fs. It's
Oh, yeah.
female, fat, fertile, and 40.
Beautiful.
Yeah.
You expect somebody who's a little overweight.
I think
has
they
had
added flatulent in there, too.
Oh, great.
Nice.
That's had the 5 Fs then.
Nice.
So they've had a couple of kids, and they're getting older, and they're women. The first person who ever walked into my office with it was a skinny 19-year-old boy. And I was just like scratching my head on these symptoms. Didn't catch it the first visit, but by the second visit, when it was getting worse, I started thinking back, like, what are all the different things it can be? And I remember even thinking gallbladder. I'm like, nah, it can't be gallbladder. He's not female or fat or fertile or 40. And his body just didn't read the textbook. So
Wow.
I have to imagine, no matter how much science and technology we have, at some point you just don't have what you need to make the diagnosis, to make the call. They're searching. They want to find it just as much. On one hand, they want to find it and fix it and get over it. And on the other hand, they want to believe that there's nothing really wrong. So it's tough. But, it's tough from all sides.
Yeah.
So Adam, if I understand it correctly, he has a blood disorder as part A to begin with that runs in the family.
Well, he actually tested negative for thalassemia,
Oh,
so
he
he doesn't
doesn't have
have that, but
thalassemia.
that's just something in our water, I guess, now.
Okay. But so he has something totally different. He just can't stop producing cells.
Yes.
Is it an autoimmune disease?
So it's
The
not
onset's really late.
right. The onset is pretty late, and typically this isn't, again, something that's seen in anyone but the geriatric population. So Adam's case is very strange. It's what's supposed to be a chronic, slow-moving blood disorder, but in Adam's case, it's an aggressive, fast-moving blood cancer. Yeah.
So down to leukemia.
Well, it actually, in the process of Adam's journey, it had actually transformed at some point into leukemia, and he had to do 2 rounds of induction chemotherapy, which involved a week-long course of chemo treatment and then 3 weeks thereafter to stay inpatient so that his numbers could come up and he could be isolated during that time, because when your numbers are as low as his were, we're talking about, 0.1 white blood cell count and super low neutrophils, you have to be isolated because your immune system is just shot.
Isolated in the hospital, just removed from everybody else?
You can't go into my husband's room without a gown, a mask, gloves on. My kids have seen.
That's when he had no leukocyte, when his white blood count was really low.
Even now, because he had to do a second dose of the induction chemotherapy because he had actually gone home after being inpatient for 9 weeks and went home when his numbers were slowly starting to come up. We had anticipated that because, again, chemotherapy and other cancers can be a cure, but in Adam's case, it is really a means just to buy time until the transplant takes place.
In the chemotherapy, what's it targeting?
It's basically trying to stop these fast-moving cells in their tracks by killing them.
Of scar tissue growth?
So it's not going to kill the scar tissue growth. It's going to kill the cells, because that bone pain that he was experiencing, what that actually is the density, like the volume in his bones. The marrow is a very narrow space, and it's so packed with these cells that it's just they're pushing out and putting pressure on his bones.
From the inside.
Exactly. And so what the chemotherapy does is it kills the cells, and then you don't have as vast of a number of cells in the
There's
body.
not so much volume in there.
Exactly. And he's also
But
on.
it's just going to come back.
Yes, he's also on a chemo pill that's called. There's Jakafi. There's a lot of tomato there, but is this wonderful drug that really helps him with minimizing his night sweats, minimizing his bone pain, and another thing that I had forgotten to mention, another telltale myelofibrosis indicator is an enlarged spleen. And Adam complained of a lack of appetite. And what was happening, unbeknownst to any of us, was that his spleen was getting bigger and bigger. And it was actually pushing against his stomach, such that he was feeling full after 2 bites of a sandwich.
Oh, wow.
Oh, wow.
That's how big it was.
Yeah,
Jeez.
yeah.
Splenomegaly.
Yes.
Is there a time frame on how often you can do that? I mean, it sounds like it's like the cells grow big. There's no room, so you chemo them down. They grow big.
Yeah. So it really depends on the person. Adam went home thinking that he was going to be able to do some outpatient chemotherapy and stay home until we got things in order for the transplant to happen. But within 3 days or 4 days of being home, he was already putting frozen peas on his knees because he was achy. And we thought, this is just the course of the disease. But then by day 4 was already feeling woozy, lightheaded, losing his appetite again. And by day 5 was already experiencing fevers as high as 102 and was back in the hospital by day 6 getting antibiotics and antifungals. Just they worried that perhaps this was, him getting sick, but not cancer-related necessarily. Until the following day where he was at 103 and in excruciating pain, and they just said, we need to start induction all over again. So it was 9 weeks inpatient, 1 week home, almost a week home, and then he's been back already for 6 weeks.
Back in the hospital?
Yes.
What do you mean by induction chemotherapy? Is
Okay.
that different from other kinds of
Yeah.
chemotherapy?
So, for example, Adam had done a number of courses of a chemotherapy called decitabine, which is fairly well tolerated. You keep your hair. That was the question that a lot of people had. If you're having chemo, why do you still have your hair?
Oh, because that type of chemo doesn't hit the hair.
Mm-hmm. And so, and I know that perhaps sounds vain as something that's exciting or but you have this 31-year-old virile, athletic guy who all of a sudden loses his hair, and that's what made him look sick. Because in all that time that he lost the weight, he was still pretty tall. He was still pretty athletically built. But him losing his hair was really hard for him because it felt like, now I look sick.
Now he feels like a cancer patient.
Yes. And he held on to it for quite a bit of time. I remember having conversations about, let's buzz it, let's own it, but this is his decision to make. This is, that was, his choice. And I'm glad that we waited as long as we did because, he needed to choose what was good for him and what was right for him in that moment.
So is induction a brand of chemotherapy?
So what it is induction is it's basically a marriage of different kinds of chemotherapy. And you can have different forms of or different groupings of these 3 drugs. But basically it's these 3 drugs given to you for a few days in a row, a week. And induction is a very strong course of chemotherapy, so much so that, again, it's inpatient. It's something that requires 2 to 3 weeks of staying in the hospital post for your numbers to come back up because it literally obliterates the system.
Is it only for blood cancers or is it for every
You know what?
other types of cancer?
I'm not sure.
Way to put her on the spot.
Yeah.
Sorry,
No,
I'll look
it's
into
fine.
it and I'll email you.
Let me know.
Yeah.
All right. Now, I mean, is Adam going to be stuck at the hospital until he's cured?
until his transplant. 99% so, yes.
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 Okay. So at this point, you know that, because they already told you earlier, bone marrow transplant would help him,
Yes.
but that you wouldn't need it for years.
Right.
And
That's
then
what
all
we
of a
had
sudden,
initially thought.
Things just turned really quickly from a old man, slow-moving tissue cancer to a rapidly developing cancer in a
Yes.
young guy taking him down. So then the pressure for bone marrow transplant goes up dramatically.
Oh,
right?
yes.
And what's that process like? I mean, you need to find somebody who's a match. And what does that even mean?
So a match, a lot of people will say things like, oh, what blood type is he? And that actually, to a strong degree, doesn't matter, because what'll happen is before you get transplanted, you get a course of what's called conditioning chemotherapy, which is so strong that it wipes out all your bone marrow so that your body can then accept the incoming stem cells. And you then take on the blood type of your donor. And so it doesn't really matter what blood type you are.
So you get to choose the blood types, potentially.
In theory, you can. There was certain situations, like there was someone who was O positive as a donor, and that makes them not as ideal in the sense that you become this universal donor, but it's harder to find matching blood types.
Well,
Right.
yeah, I don't know how much people know about blood types, but there's a protein there's two. There's either the A protein or the B protein that sits on your blood, and if you have A, then you're A. If you have B, then you're B, and if you have both, you're AB. But if you have neither one, you're O. Your body can only accept blood with protein types that you already have. So if you're O, you don't have either A or B. You can give to anybody because they're not going to reject your blood. But if you're AB, then you can take from anybody. You're a universal receiver because you have A, you have B, you have AB, and you have they all compatible with you. So you're saying it's better to take an AB than an O
Apparently so. Yeah.
if you have a choice.
Right.
What does make somebody a good match?
Someone who shares what's called your, what happens is you basically get something that's called your Hla typing. And it's sort of like this genetic code, so to speak. It's a series of alleles put together. And that is the best telltale indicator for what makes you a good match for somebody else. And you can have what would be a 10 out of 10 match, which is your perfect match.
Right.
In an ideal world, Adam would have had a matched sibling, a perfectly matched sibling, because that would have been perfect.
How many siblings does he have?
Adam has a brother and a sister.
And
both.
they're not the same.
His sister, in fact, the transplant coordinator said something to the effect of, your sister and you might as well not be related in terms of your
Oh, wow.
Hla typing.
Oh, really?
Yeah.
Yeah.
And then his brother is a half match.
Okay.
And so there is that's sort of like the new school of thought, and there's still some controversy about that. They are doing amazing things with half matches at Johns Hopkins, and that may very well be,
The future.
yeah, the
But not
future of
today.
transplant.
Yeah.
Right. I was looking up statistics last night, and I think for cord blood, let's say the baby is 100% match, of course, and then the siblings have a 50% chance of being a match, but the opportunity to have 100% match with your siblings is like 25%.
Yeah.
So it's still not even
Was there
likely.
a chance that your kids would have been a match
Yes. However, they're too young.
to donate?
Yes. If we had, this young 19-year-old son, that would have been wonderful.
Yeah.
But
Did you test them?
no.
It's probably better not to.
Yeah.
What's the age for donation?
Well, in the United States, it's 18 to 45.
Okay.
Or 44, I believe. But again, that sort of varies. Like Canada is something like 17 to 35.
Oh.
Different countries have different requirements. I think there was a girl in the UK, a 16-year-old girl, who just became the youngest marrow donor, stem cell donor in the history of the world.
Wow.
Yeah,
Sweet 16.
pretty
totally.
amazing. Seriously,
Totally.
right?
What
You're 16 years old and you save
conscientious
somebody's
teenager.
life.
Yeah,
over
and
there.
maybe get a
So-
license too.
Yeah, really rad.
and then have a little party. So for this particular disease, you need to erase all of Adam's bone marrow because that's what's overproducing. I mean, his genes. How does that work? If you give him new bone marrow,
So a couple of things have to happen. Right now, For example, Adam, we've also discovered that he has a very high antibody count to anything A positive blood-wise. And so if his future donor because Adam is currently B positive.
Okay.
So even though the blood type doesn't matter that much, Adam would actually have to have these antibodies physically removed from his plasma before the transplant.
They just filter them out?
Filter them out.
Wow.
It's amazing it literally
incredible.
sounds like a sci-fi
Yeah, or
movie.
just like,
Like
an
in
app
the
on your
middle of
phone.
it, a la Spaceballs, like a little alien's gonna burst out of his stomach kind of thing. It's
Yeah.
crazy.
To me, it just sounds like an app on your phone. You know,
Right.
like search or on like Microsoft Word, search for these and just get rid of them.
I'm telling you.
It could be a game,
Right?
like remove all.
Little Pac-Man.
Yeah, for
Going
little in science camp.
Yeah.
That would be a great little game. So it would be better than if he got somebody who's his own blood type.
Perhaps he wouldn't have to have that done. But again, I'm
Just
looking
removes
to
a
have
step.
yeah,
Yeah, again, if you had lots of choices.
totally. And it hasn't been the case for us, but
Right.
yes.
So there is an international registry of bone marrow
Yes.
donors or registrants, potential donors. Do you know how many people worldwide are registered?
There's about 24 million people on the worldwide registry, and I know that sounds like this gigantic number.
No, not at all.
Okay, but if you think about it, it's less than 0.5% of the world's population.
It's just half of California.
Yeah.
Yeah.
And there are countries out there, Adam is, I had mentioned Hla typing being a super important indicator of how well you might match up with someone else. But something to take into account is that typically you will match up with someone, or you have a higher likelihood of matching up with someone who has a shared heritage with yours. So Adam's parents are Moroccan on both sides, so Adam has a higher likelihood of matching with someone who is Middle Eastern, Moroccan, than he would perhaps with someone living in, Central Asia.
Right. I really didn't occur to me that there's so few people registered.
Yeah.
Right, and then she was telling me earlier that 3%, right?
Yeah.
3% of registrants are minorities. Everyone else is not, and that's why they're having trouble.
So that's the thing, is that in the United States has the largest registry, and Germany actually has the second largest worldwide registry. So if you are Eastern European, Caucasian, you're in luck because chances are you have a match. In
Right.
fact, I remember walking around the hospital, around the floor the other day, and Adam turns to me and he says, "See that guy over there?" And I said, "Yeah." And he says, "He has over 100 10 out of 10 matches."
Holy cow.
Adam had one on the registry, and she was a perfect match, a 10 out of 10. And we waited weeks to hear back because she said she had to think about it, and ultimately she declined for whatever reason. And it's
That's gotta
so
be like
it's
crazy,
devastating.
Devastating.
Very much so. It was
Sort of imagine
life-altering.
whatever's going on in her life, though. It's also kind of devastating.
for sure.
To
I
have
never,
to say
yeah,
no.
yeah,
Which is something I want to talk about when we get into how do you register and what's it like to
sure.
donate. I feel like we should take a quick break and then come right back.